Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Succinylcholine and its side effects. So when you look at the CVS, under CVS it forms the sinus bradycardia. Then is the junctional rhythms. Junctional rhythm. Then comes ventricular dysarthria. Ventricular dysarrhythmias. Next is hyperkalemia. Hyperkalemia. Next is myalgia. Then there is also masseter spasm. So there is masseter spasm. Masseter spasm is nothing but there is a succinylcholine. So succinylcholine, it can trigger the malignant hypothermia. Malignant hypothermia. Now let's look at the increased intracranial pressure. So increase in the ICP, increased intracranial pressure. The succinylcholine may lead to the activation of the EEG. So it leads to the activation of EEG and a slight increase in the CBF and the ICP in some patients. So the slight increase in the CBF as well as the ICP in some patients, the intracranial pressure. Now it also produces an increased intraocular pressure, IOP, as well as increase in the intragastric pressure, IGP. To learn and grow daily like this, please do subscribe.